Tired of failed filling in primary teeth? The whole technique might be just the solution that you're looking for. Hello colleagues, I am Bahare. I was a dentist in Iran and now I work as a dental nurse in the UK. Today I want to talk to you about Hall technique, which is a very minimally invasive technique for treating primary molar teeth. What I'm sharing with you today is based on a systematic review and some other recent clinical findings. But instead of overwhelming you with the details of how they did their research and things like that, I will just focus on what you will need for your practice, like how to do it, when to do it, the pros and cons, and what are the outcome of this treatment plan. So, what is the Hall technique? The Hall technique was introduced by Dr. Nora Hall in 2006. For this technique, they used preformed metal crowns, which is known as SS crown, but they did all the necessary steps that we must do before we place the SS crown on the primary tooth, like crimping and things like that. And the interesting thing is that there's no need for anesthesia because we are not going to do any kind of drilling, caries removal, or anything, or any kind of preparation. The idea for this technique is that when we seal the bacteria underneath the SS crown, they won't have access to any kind of nutrition that they need, so that the caries will become arrested and won't progress and infected the pulp or any other problems that the caries might make for us. Let's jump into the indications. So, when we see occlusal or proximal caries, most of the primary teeth that we see, they have caries from buccal, from lingual, from mesial, from distal, and we all know that any kind of fillings like glass ionomer, composite filling, or amalgam, they won't stay in such a condition. So when other kind of restorations, they're difficult to place, when the child won't cooperate, and when we know that mostly in multi-surface caries, the amalgam won't stay in that tooth for long. And as we know that all dentists, all parents, they all want to prevent operating anesthesia because we all know that it is one of the procedures that they don't like, and it will trigger the child for becoming uncooperative and don't stay in the operating room. So the best indication is for a primary molar with multi-surface caries, and we know that it is going to be retained for more than 2 years. We can use this technique. And what is the contraindication for this treatment? If we see any kind of signs that shows us that the pulp is infected, or we see PDL widening, we see that the child has pain on this tooth, or any other kind of things that we see in radiograph or in clinical examination, we can do the Hall technique. And actually, if we can't put a SS crown, there's no teeth that we can put a SS crown, so this is not an indication for crown placement. Or if we know that the child is too young, that the child can't bite hardly on this SS crown, because we need their bite force to place the SS crown on the place. So it is a contraindication as well. So the interesting part, how is it done? If we see that the contacts are tight and it will make it for us really hard to place this crown on the tooth, we must use orthodontic separators between the contact points to make just a little space for our SS crown. The separator can be placed for 3 to 5 days. That's enough. After that, we must choose a snug fitting SS crown. And we don't want it to be wobbly, we don't want it to come out easily, and so it just be the right size of SS crown. we will fill the SS crown with glass ionomer cement. We place it on the tooth using finger pressure, and after that we will put a cotton roll between the teeth and ask the child to bite down so that the SS crown will go in the right place. As you know, we didn't do any kind of preparation on the tooth, so the bite will be open and there will be an open bite. And we must reassure patients that this overbite will be resolved in a few days or weeks. So here's the advantages of this treatment plan. This is non-invasive, no local anesthesia, no drilling, so it's perfect for an uncooperative child. And also for children who have lots of caries and all their molar teeth are infected and they need to do pulp therapy and we have lots of appointments. With this technique, we can do 2 or 3 in the same appointment, so it will save us a lot of time. So as I told you before, it will make a biological seal, so they will seal the bacteria underneath the SS crown and the caries will be arrested. Let's talk about the durability. If you're a dentist and work as a pediatric dentist and you did a lot of filling like amalgam, composite, glass ionomer on primary teeth, you know that they won't last long. Most of them is because of the anatomy of the tooth. And for a child, we can do our best. And for the shape of the preparation for amalgam, and sometimes we can do a very good isolation. So most of the time, the filling will fail after 1 or 2 years. So for really young patients who we know that their permanent premolars will come out 5 or 6 years, we know that amalgam filling and composite won't last this long in a child mouth. So they compare the SS crown durability and other kind of fillings durability. They said that the whole technique crowns were about 80% more likely to succeed. That's a really good result. It is really cost effective and really quick in our daily practice. There are a few concerns about this treatment plan. As you know, parents are going to tell you it's kind of metal, it's not white, we don't like it, maybe some of the children don't like it as well. That's the concern. There is the temporary changes in occlusal. I myself, when I knew about this technique, it was really weird for me because everybody who taught us how to do the SS crown, they told us that the bite after placing the SS crown must be just the same before you do the SS crown. And they said that the bite is really important, not for the bite not to be open. That was a question for me, how this technique is going to work. This technique is going to be a good technique if the bite will be open after using it. Actually, they said that studies report that there's not gonna be any issues with the bite because it will resolve after a few weeks and that's it. And they say that children will adapt really quickly with their new bite and there's no concerns. Let's focus on evidence on success rate. Survival was 90 to 97% success after 1 or 2 years, and around 70% is still functional after 5 years. That's quite a result for this treatment. Compared to conventional fillings, they are really lower failure rates for hard technique. Actually, but there was just a few cases that they had pain or infection after this, and this is not just because the SS crown or because they didn't do it in the correct way. It's just something that happened with all other treatment plans. The whole technique is not a universal plan for every tooth, but it is really good for you and it will really help you to know about this technique and to know how to do it, because there are times that you can't do any other things except this technique. For some child, for some parents that they are really concerned about anesthesia or other kind of treatments, and evidence suggests that there is a really long-term success for this treatment plan, and it is biological, minimally invasive, so all of us can benefit from this treatment plan. I hope this video helped you understand the logic behind Hull technique and how to do Hull technique, and you will be able to use it in your daily practice. Don't forget to like and subscribe. See you in the next video.